everybody, and a heartfelt February welcome to today's CILIP's online learning. It is truly fantastic to see so many of you here to get to know and love health libraries, a sector more essential now than ever in combating dangerous misinformation, upholding evidence-based practice, and increasing information literacy in everything they do. So my name is Kirsten, I'm Membership Officer for CILIPS, and we're also joined by my colleagues Sean and Leah. So if you need anything throughout, please don't hesitate to send us a quick message in the meeting chat. To get the technical side out of the way and onto the good stuff as quickly as possible, I'll simply point out that, as you're aware, we are recording today, but only in speaker mode, so you won't be very visible either way. It's entirely your choice whether you keep cameras on or off. It's always lovely to see everyone's faces, but if you're struggling with bandwidth at all, we might suggest popping the camera off. If you could please keep your mics muted for now, we'd appreciate it, just so that we can hear our presenters, although there will be an opportunity to ask questions later on. And captions are enabled, which you can toggle on or off, depending on your preference, by using the toolbar at the bottom of your Zoom screen. And with that, it is a real pleasure to welcome, or rather welcome back to CILIPS, Elizabeth Carney, my predecessor in this role, who left a very big book jacket to fill and who continues to do so much for our community, advocating for how health librarians add value in her current role with NHS Forth Valley. So Elizabeth has been instrumental in orchestrating today's session, and we are so grateful to her for that. Today, we're going to be learning about the Knowledge Network, the National Digital Library for Delivery of Health and Social Care in Scotland, and we'll then enjoy a series of lightning talks from, at last count, 6 LKS staff working across NHS Scotland, hearing more about the vital work that they are currently undertaking. So thank you so much to Elizabeth, as well as to Katie, to Derek, Fiona, Amanda, Carol, Andy and Igor for joining us. Whenever you're ready, team, the virtual floor is yours.
Hi. Okay, hi everyone. Yeah, thank you so much for having us, and thanks to Kirsten and Sean and Leah for inviting us on today. It's really great to be here to sort of chat to you about health librarianship and get to sort of showcase some of the work that is going on currently within NHS and health libraries in Scotland. So we do have quite a packed schedule. As Kirsten was saying, there's a number of speakers, and it's going to sort of be like a lightning talk style presentation with a number of different speakers and presentations, so you can get an idea of some of the work going on at NHS Scotland. So I'll just pass over to Kate and Derek at the moment from NES, and they can kick us off.
Thanks, Elizabeth. Thanks, Kirsten. Hi, everyone. I'm going to share my screen and run through just a little presentation to tell you a bit more about who we are and what we do.
Joe's bad.
So, we are the Knowledge Services team at NHS Education for Scotland. And to let you know who we are in a bit more detail, my name's Kate Edwards and I'm a Knowledge Manager working in the team at NES. I've worked here for 10 years, I think, now. And I'm joined by my colleague, Derek. Derek, would you like to introduce yourself as well?
Yeah, good morning. It's great to be here. I'm really looking forward to the session. My name's Derek Boyle. I manage kind of the work of the Knowledge Services team in NHS Education for Scotland, or NES as we like to call it. I've been in NES for 20 years. So our work involves kind of the delivery of the digital library, the Knowledge Network, which is currently undergoing a long overdue redesign, hopefully launching in springtime. So yeah, no, it's great to be here. I know there's a lot of talk, chat going on, presentations going on this morning, so I will pass back over to Kate to give a bit more detail about our team and the work we do. Thank you.
Thanks, Derek. So we are real life librarians for a digital library. We come under a lot of different names these days, but that's what we are in our hearts and souls. As Derek said, we manage the Knowledge Network, which provides equitable access to online library resources for all health and care staff in Scotland. We are a national service and we link the digital library to the physical library collections and services, and we work in partnership across NES with our colleagues in the other library services who you're going to hear from today, and social care in Scotland in general. We also provide staff training on using the Knowledge Network and information skills related subjects, quite a wide remit. I've mentioned the Knowledge Network a couple of times, so what is it? It's a digital library. The URL's on the screen there. You can go and have a look at it, although as Derek says, we are planning a redesign, so it's going to look a lot better than it does now shortly. It's for all health and care staff in Scotland. It's funded by NHS Education for Scotland, but everybody can use it. And it provides access to your usual library resources, e-books, e-journals, articles, but also clinical decision-making tools and evidence summaries, which are much more health focused, and also current awareness services, your usual gamut of excellent library resources. The access is totally free for health and care staff when they log in with an NHS Scotland Open Athens account. So a little bit more about the rest of our team who we're representing today. We have, just to give you a sort of idea of the sort of range of roles when you're managing a digital library in the health sector. We have our infrastructure and user support roles, so they'd be like your digital inquiry desk, but they also do a lot of content. They manage the Open Athens accounts as well, general library management and discovery, content management, and your help desk and copyright inquiries as well, although of course they go to the local library services too. And then we've got the outreach side of things, so knowledge services for NHS education staff, like focused on our kind of organisation, promotion and training, knowledge management, and the K2A network, which is the Knowledge into Action network, which is the network of library services and others with a kind of knowledge broker role across Scotland. Just a kind of quick case study to give you an example of the kind of things that we get up to on a regular basis, focusing on GP trainees. So the session that we run with them is accessing and appraising evidence for clinical practice. NES currently trains all of the GPs in Scotland, which is a fairly recent development and pretty cool. Sorry, Derek's just let me know that I'm breaking up a little bit. Can you still hear me okay?
It's going in and out slightly, Kate. I don't quite know what's happening. Yeah, a few people have said it's just slightly erratic. That's a shame. We can certainly, as I say, the captions are running, everybody. There might not be much else we can do.
Sorry about that, folks.
Yeah.
It's probably just my internet. I shall close a few things and see if that helps.
Thanks, Kate. And as I said, everybody, the captions are there, so we'll try and keep them as accurate as possible. Thanks, Kate.
And what I've got on the screen is kind of a reflection of what I'm saying. So hopefully that's keeping you going, but I'll be quiet soon. So we provide a session as part of NES's training for all GPs in Scotland, a very large group of people, and they get younger and younger every year. Used to be all different regions, but now, as I say, it's a national provision. It moved from face-to-face to online during the pandemic, and now it's mixed. So we're back to some online provision and some face-to-face, and we provide a mix of synchronous and asynchronous training. So it's watch some videos online and then you come to a session and you get to take part in a breakout session where you critically appraise an article, use the CAST checklists, and we do manage to do that online as well as face-to-face. So that's been a bit of a learning curve for us. And then you've got the usual kind of thing, polls, liberating structures and other activities. We try and make it as interactive a session as possible, especially online, to get that kind of engagement. I think I've still got a couple of minutes. Just a wee summary of some of the other things we're working on. Our redesign of the knowledge networks launching in spring 2024, so our website will look a lot better than it does now. Integrating services for health and social care. Historically, these have been quite separate, so we and the rest of the service in Scotland are trying to bring them more together, but that process has been going on for about 20 years, so it's small steps. We continually make improvements to our library search, which is provided by Primo, and we're preparing for our next tender for subscription resources starting from April 2025, so we have to go through that process every few years. And we're always updating our e-learning, particularly the copyright one at the moment. And I think I should hopefully be able to give you a little preview of the changes coming through our knowledge network. This is going to load for me. There you go. So this is what our redesigned knowledge network is going to be looking like in the coming months. So just flash by them quickly. And that's going to be the library search. There we are. It's much more modern, much more up to date. And I'll share the link through this way. So if you are interested in what health libraries get up to, you're very welcome to sign up to our newsletter, which is called The Knowledge Nugget, because we're hilarious. And you can follow us on social media, and you can always get in touch with us as well. We'd be delighted to hear from other librarians if there's anything we can do to work together. And what I'm going to do now is stop sharing, and I'm going to pass over to my colleague Fiona Turnbull, who's in NHS Highland, and that's the first of our lightning talks from the rest of the library services in Scotland. Thanks, everyone.
Thanks, Katie. Let me find my slides. Okay, like Katie said, I'm Fiona Turnbull. I'm the librarian at Lornan Islands Hospital Library. We're based in Oban on the west coast of Scotland. And you know what? This is National Storytelling Week. So I'm going to tell you a story. And I'm a great believer in doing things with pictures, and it's sort of a modified Pechakucha presentation, if you know what that is. I love Pechakuchas. So we're going to learn about what it's like to be a hospital librarian through my experience. My day starts off on a farm. I live just south of Oban on a sheep farm, but I have nothing to do with the actual management of the farm, although I can gaze out my window and look at the sheep and the chickens and get my day started just right. And we're getting ready to start lambing on the farm, so I'm soon going to see all of those cute little things kicking their heels and enjoying life, and it makes it a pleasure to start out my day that easily. Then it's a quick 15-minute trip from my front door to my desk, and I end up at the hospital library. Oban is a relatively small community, about 8,000 people, but our service area includes all of NHS Highland, which is approximately a third of Scotland. We're pretty spread out. We deal a lot with people in remote and rural locations and on some of the islands. And as the only NHS library in Highland, we often end up having to support a lot of those people with all kinds of activities that you will learn about in just a minute. We do provide 24/7 access to our library with key cards. So all of those poor junior doctors stuck overnight that need a place to come and hide out often sneak down to the library. We're compact. We have about 3,000 volumes and only a small amount of workspace, but we are, believe it or not, still heavily used. The next thing I have to do is check 3 different email accounts. During the pandemic, library services became the de facto comms team for the hospital, and it's a role that we continue now. When I say we, I mean me. I have a library assistant, but that position's been vacant for the last year, although we've recently filled it. I also have an assistant who manages postgraduate medical education coordination. So between the 3 of us, we handle all kinds of teaching, learning, and stuff around here. So I've got the email account for the library, I've got my personal email account, and then I have the hospital email account. After that, we jump into Teams and see what wonderful things have developed overnight. I'm on so many teams now, I can't even keep up with them all. But it's been a boon to what we do and to help coordinate not only within the hospital, but all of our colleagues out with. After that, we start compiling In the News, which is a daily newsletter that we put out. It scans mainstream media for the most part. And I like to say I come up with the 20 most interesting stories that you want to read about health, social care, medicine. We include in there every day some sort of tip about research, a meeting, something like that. We provide access to a podcast because I spend a lot of time listening to podcasts. some sort of resource from the Knowledge Network, and we recently added in a section that includes some sort of feel-good story because I got tired of all of the depressing things. And we also include links to all of kind of the health awareness campaigns that are going on at this particular time. We also once a week publish a document called Team Brief for hospital staff, and that includes all kinds of different things. And now I find that I'm included, it started off during COVID, but I find it includes more and more kind of learning and knowledge type opportunities. And we've also launched 2 current awareness bulletins. One's dealing with spirituality and healthcare, and the other one is dealing with social prescribing. So if you're interested in those topics, drop me a line and I can add you to our distribution list. If I have any time left in the day, which I do, I then have to manage the social media accounts. One of the interesting things that has developed is because we manage the hospital's Facebook page, we've started getting messages from the public directly that we have to deal with. And it can be anything from how do I find a patient in the hospital to can you help me get my medical records from when I was there? All kinds of different things that we help people with. So we kind of triage and point them in the right direction to fabulous people that can answer their questions. I spend a lot of time on Twitter. I refuse to call it X. And interact with a lot of our users and also other colleagues that way. It's also somewhere that we distribute our In the News newsletter every day, which is now part of our Sway collection of documents. And we get good feedback on people using it. After that, we have to handle the stack of interlibrary loan and document delivery requests. Because we cover all of Highland, we deal a lot with people remotely. We get books from all of the NHS libraries in Scotland that people need to use. And likewise, we send out books from our collection. And we get requests all kinds of ways. Sometimes somebody's just starting a course and they send me their reading list. And we do everything we can to facilitate getting what they need. If necessary, we end up buying additional copies of particularly textbooks that are valuable to our users. A lovely service. We love it because it's part of the Knowledge Network and we don't have to manage all of the behind the scenes stuff. Next, we would have to look at shipping things out to the staff that are not here in Oban. Like I said, we've got people on islands. They're obviously not going to come here, so we make it easy for them to get the materials that they need. We package them up, and then of course we have to get them back and make sure they're here. I don't know. I was showing somebody the other day how we do what I call proof of life. When somebody needs to renew books and they're out of their renewal options online automatically, I get them to send me a photo of the book sitting on their desk. And that to me proves that it hasn't slipped down the back of the sofa or anything like that. And we can continue renewing. Because quite frankly, if you had to take a ferry to bring your books all the way back here just so we could see them, it's something that you don't want to have to make them do. We'll often be doing literature searches for everybody from senior management to somebody who's the head of a prestigious medical society who recently asked for our help, down to people just starting out on their recertification, or perhaps they've gone, they're going on to get a master's degree and it's been a long time since they've been in formal education. We sit down and help them get organized and find the materials that they need. We also provide support to TAM. TAM is the Treatment and Medicines application. We tend to be on the evidence side. TAM has been rolled into part of the Right Decision Service, which I think somebody else is going to be talking about. And we are there to help make sure that they get the right evidence to support the treatment and guidelines that they're posting in the app. We also have to manage the collection. We still have a physical collection. Like I said, it's about 3,000 volumes. And I like to think of it as a carefully curated collection. So it's the usual things that librarians have to worry about. How much space do we have? What can I get rid of? What's old? What are the new topics that we need to include? We started a brand new collection last year in artificial intelligence and healthcare, which has been quite well received. And we also have things like a wellness collection for staff because we support a lot of the health and well-being activities of the council. I also spend a lot of time at events like this where we collaborate with other librarians and other boards. It could be supporting the National Tools and Measures Catalog or working with the print archive. We still maintain collectively an archive of physical journals because not everything is on the internet. We're always doing things. We worked with the Collective Force for Wellbeing group that looked at us reaching out to working with public libraries and other community organizations to see how we can better support library knowledge services. There's always something going on that we're up to. I also have responsibility for managing the hospital website and also the library intranet. And there's only so many hours in the day, so it's probably the thing that gets neglected the most. But we try to keep them up to date. And with, I think the next one, yes. I'm also a Microsoft 365 champion. We're part of a national project to roll out Office on the web and all kinds of upgrades to Microsoft Office. And they recruited champions certainly all over the board. We attend a lot of meetings and then we have to help kind of roll it out in our local areas. So we're getting actually closer to the point where people are going to have to start doing things like cleaning up their files to join SharePoint. And I do a lot of hand holding and we run Teams things to give people the latest information about what's coming out and what they need to worry about. The latest panic this week is learning that you won't be able to upload or download files from a non-NHS computer. That sent a stab through the heart of a lot of people. But we're going more and more to everything on the web. And our little group are the people that are going to be helping people certainly locally with that transition. I do lots of computer training, just like Katie said. It's everything from helping the domestics find their pay slips or look at their pension reports, helping people doing the research process, finding books, or accessing online journals and other tools that we use. We also do a fair amount of in-person training and sharing of information. I teach online, all kinds of things. Word Magic was one of my favorite little things, talking about a project where we have a gigantic magnetic poetry board out in the hallway and how that works. I also teach and present in person. I recently came back from the Realistic Medicine Conference up in Inverness, where I was talking about library and knowledge services. So we get out there, we spend a lot of time spreading the message. We also manage here in the hospital junior doctor inductions. It's our one opportunity sometimes to convince them that using the right evidence and the principles of realistic medicine, and we're here to support them. And we do that now about 4 times a year as they come through in different cycles. And if there's free time, we put on events. We do fabulous book giveaways, one of which, when we did the Jack Monroe book, involved cooking recipes from the book and having people come to lunch. Last year, we gave away 200 copies of the Scottish Book Trust book called Adventure. We have a book exchange program. We run a book club online. And there's a picture from our magnetic poetry board out in the hallway. There's never enough hours in the day, but it's part of what we think of trying to keep things positive and moving around here. But I can tell you, there is one thing that I don't do all day, and that's sit and read books. that's all I've got to say. So I am going to stop sharing my screen and pass you on to Amanda Minns from NHS Lanarkshire.
Thanks, Fiona. I believe that somebody's going to bring up slides for myself and the next two speakers, so I'll just wait for that and then I'll get started.
Great. Kate, are the slides with you? Oh, perfect. Thank you.
Great, thanks, Katie. So I'm just going to talk quite specifically, just for a few minutes, on two pieces of work that we're quite involved with in NHS Lanarkshire. My colleague Carol will go on and talk a bit more about other bits of work, but these are two areas that we found have a huge amount of focus and take up quite a lot of time for us now within NHS Lanarkshire. So the next slide, please. The first that we're looking at will be app governance. So app use and reliance in health boards has increased really dramatically over the past few years. And of course, because we're the NHS, safety and governance is at the heart of everything that we do. But app use and the approval to use apps and the governance to go with that doesn't always run at the same pace as use. Apps can be downloaded in a second, governance processes and the need to embed them well takes a really, really long time, and it can be quite challenging when it's really easy to do something and you have to pause all the time and check that actually you've done it in the right way. So the evidence team was being regularly asked to give advice on this anyway, and I think that was because we're quite heavily involved in lots of other areas of governance. Board. Librarians within healthcare tend to have that very systematic approach to all sorts of things because we all run governance in different ways. So we were already involved in this work, and the management of guidelines and policies are already within my remit. We're seen as a department that could add value supporting those in this new landscape. So I think the use of apps, artificial intelligence, these types of things, there are lots and lots of questions around them and how they can be used appropriately, particularly within healthcare. So I think people wanted to chat to someone else about it. Very much like, literature searching, some people have a very surface knowledge of it, but when it really comes down to it, they do want to speak to an expert. It is an area of much increasing risk within a health board as well. If we're going to recommend apps to patients, we need to be 100% sure that the entire content of that app is accurate. And that was a real problem because most people don't look at an entire app, they look at the bits that they're quite interested in. And we're good, all librarians are good at metadata, at systems and at processes. So what we were able to do is, and I think the team, the evidence team within Lanarkshire, we spoke about this a huge amount before it really became a bit of a thing for other people, because I think we could see the risk coming. We could see that a lot of people were asking questions, a lot of things were being purchased, sometimes duplicate things were being done, and people were buying things that were probably already being bought. People weren't aware of what was available nationally. There was no one place to keep a lot of that. So the evidence team were key in the formation of the app governance group, which is run under our digital partners within the board. And we have jointly led that work, and we have made recommendations to the board on how apps and the use of apps with healthcare can be managed appropriately. And it's very much in its early stages. We're just about 18 months in, and I think I've rewrote or adjusted the app policy 4 times already, because it's just such a moving feast. And even at the start, the digital lead said there's only so much we're going to cover in the first iteration. We can't possibly cover what the world of apps is. We're just going to look at apps that we are creating from scratch that will belong to NHS Lanarkshire and the standards that need to be in them because they're public, and apps that we want to adapt. So we're taking healthcare apps that have already been built and we're Lanarkshireising them for our own. We're not even starting to cover in the first 18 months apps that we're just recommending that patients use. That's what we're starting on now. That's our new journey in the next 18 months. And it has a natural links within Right Decisions as well, which again, someone else is talking about, because that will hold national apps. So we very much try to mirror national governance. And I know that we've shared our policy, we've shared our processes with them, and they've shared with us. So I feel that everybody learns from this, and it's an area of expertise within that I think librarians are very good at. They lend themselves to this type of system thinking, that where a lot of other traditional work is disappearing, there's not really, you ask questions that digital won't ask. I ask a lot of questions around, well, can the patient understand that? How is this designed? Does this meet accessibility guidelines? Has anybody looked at the copyright? I check masses of amounts of clinical tools for copyright, and some of the costs to put these in apps they're astronomical. I got one last week to put one clinical tool into a pre-assessment app that you're looking at, it's £30,000. You know, and so your expertise is coming in lots of different areas because the team are saying, God, I never even thought to even look at this. Now we are not, we're not going to use that tool. We're going to look at a free one that is available, but it's that sort of thing. So you're really, it's being able to look at that piece of work and really say to the board, this is about reduction of risk and use the expertise you've got. This is what librarians are good at. It's not just the books, it's not the room, it's what they're holding in their head and how that meets the needs of the patients and the clinical staff. And it's excellent at raising your profile because you do become a bit of a go-to person and team for that because you can talk about it. You're used to systems. The librarians have always been at the forefront of a lot of technology, and this is another in that type of work. And the second thing, if we can get the next slide, is again, I suppose it's a profile raising piece of work, but the directorate that I sit in within my health board, and they're all different, but I sit within the quality directorate, which is an overarching directorate. So I don't belong to the medics, I don't belong to nursing, and I don't belong to digital, which is great because we work for all of those. So within the quality directorate, we have a quality strategy that is a health board strategy, and we have something called True Norths. And our True North articulates the purpose and guides the decisions on why we're doing the work that we are doing. And I think this is really important that my team, the evidence team, have True Norths listed in that, because we have to answer to these at a very, very senior level. So again, along with Carol, my colleague who'll be talking after this, we developed one which was to develop a 3-year plan for NHS Lanarkshire to become a health literate organisation which will support people to navigate, understand and use information and services to take care of their health. Not only, again, is this an area that librarians are very good at, looking at health literacy, looking at health information in a very different way, but this is one of the health board's biggest aims, is around patient experience, patient-centred care. And if we want to get really ruthless about it, if they can't think of it, that is a good enough reason. This just saves money, and there is no money. There is no money in the NHS. So we used to think there was no money, but now we really, really know there's no money. So this is just makes economic sense for everyone. If patients have a better experience, they use the healthcare service better and they use it more efficiently. So it's really important that we do this. And it does directly report into our patient-centred care and into our executive and non-executive groups. And this is great for us because I know that a couple of our non-execs are very, very interested in health literacy and patient experience, and they've asked us specifically to report on this to them. So that's a really good group of people to have in our corner. So year one was develop the plan. This year, 24 to 25, will be our second plan. And you can see there we will pilot a training programme for secondary schools on health information. We'll be developing the FY1 programme, which is our health literacy for the FY1 doctors across all our acute sites. And 2 of the staff, myself and Carol, who are on this call, we'll be gaining an official qualification in plain English, and we'll be taking that forward in the board so we could become those named experts. Thank you very much for your time, and I'll hand over to my colleague, Carol.
Thanks very much, Amanda. Yes, so I am the evidence manager within NHS Lanarkshire. I report to Amanda. I'm one of the 6 senior managers who report to Amanda under the evidence function. So I have knowledge services, which is another word for the library services. And I now have patient information for the board and translations. Next slide, please. So, as I said, I manage the knowledge services team across 4 sites, and in 2020 we took on the management of patient information for the board. So we manage the patient leaflets. There's almost 1,000 of them at the moment, and I have 4 of my team working on that. So our role involves reviewing existing leaflets. They have a 2-year life cycle. They are legal documents. So in order to ensure that patients are receiving the most up-to-date information, we have to review these every 2 years. We carry out readability checks on the new leaflets that are being produced, and increasingly we're being asked to carry out the same readability checks on things like video scripts, patient letters, patient websites, and so on. We then upload the leaflets to the intranet, but we are in the process of moving those leaflets onto the public site. There's absolutely no point in patients not having access to patient information, but having to rely on members of staff to give them that information. So this is a really key piece of work that we'll be focusing on. I've also developed a readability checklist. So when we took on the work, there was really nothing in place that would guide staff on how to write or structure the patient information that they were compiling. So I've now pulled together this checklist, and it really just takes them through the process of how to go about developing that patient information. We also deliver training on writing information for patients. That's the most popular session actually that our team offers. So we've delivered this to teams, departments, individuals and so on across Lanarkshire. And as Amanda said, we are now on the FY1 programme. This is a first for us. And it's also the first introduction that a lot of FY1's doctors, junior doctors, will have to health literacy. So we're very pleased to have this opportunity to go on to that programme. And I know equally that they are very pleased to be able to roll that out to the FY1s. The impact on our knowledge services profile has really been quite significant. So it's given us the opportunity to introduce and share health literacy concepts across the organisation, and really to link those concepts into the development of patient information that really hadn't been there before. As part of the knowledge services team sort of daily responsibilities, we also have a copyright checking service. And we've been able to now apply that to patient leaflets as well. So any images, photographs, guidelines, whatever, that are used in the leaflets are now checked via this checking service for copyright. That in turn reduces the risk to the board. As I said, the readability checks are a key part of our service. They are increasing in demand, which is great. You know, we're really pleased to be able to do that. And yeah, it is really valued. So this really enables us to check over the information that goes out before it's actually is actually printed. Prior to that, it just wasn't happening, and we were seeing lots of leaflets that really weren't meeting the standards that we would expect. We also have now extended our literature search, again, a standard part of the knowledge services team's work. So we've now extended that to patient information so that we know that the information that's forming the leaflet or website or whatever is evidence-based. So we've been really able to pull all the services together from knowledge services and apply them to this new area of work. It's not now actually, isn't it? Nearly 4 years now, but this area of work within patient information. Next slide, please. Thanks. So I just wanted to expand on the training session because, as I said, it is one of the most widely used session that we offer. So we cover things like why we write information for patients, some of the common mistakes that are made when staff are writing patient information, how to write information that's easily understood, and how to get a new leaflet produced or an existing leaflet reviewed. So that's the kind of internal processes. The sessions are very much hands-on, so we have a writing exercise that I ask staff to do when they're taking part, and I also look for participation from attendees. It's very much a Q&A based session that I run. What we found was through the readability checks and the feedback at the sessions, staff really weren't aware of health literacy. Some of you may be familiar with the concept. One definition is the degree to which individuals have the capacity to obtain, process and understand basic health information services needed to make appropriate health decisions. So staff could write health information, they just didn't understand why patients possibly didn't understand what was being written, or they didn't link poor health literacy to poor health outcomes, misunderstanding of the information, lack of adherence to treatment, and so on. So what I've now done is develop that session to include health literacy. So I set the scene by explaining health literacy, and then we move on to how should we write patient information, knowing now what we know about health literacy, how can we build on that and write really good information for our patients. Next slide, please. So I know Amanda's touched on the true north, and these are the key areas that we'll be focusing on. I will also be looking at, as I said previously, moving the leaflets onto the public website. This is quite a significant piece of work that we've been doing in conjunction with the comms team, communications team, and the medical illustrations team, who are the design team. And so that's gradually happening over the next sort of few months. I will be rewriting the written information for patients policy, and I'll also be developing a further policy for the board on health literacy for NHS Lanarkshire. Longer term, I'll also be looking to apply for what's called PIF tick. PIF is Patient Information Forum, and this tick mark is the UK quality mark for health information. So it means that our health information that we write for patients is going to be reliable, accurate, and trustworthy. So that's just some of the key areas. Lots of work coming our way for patient information, but hopefully that's given you an overview of the patient information work that we do as knowledge services, and the links that we make into knowledge services and also health literacy more widely. Thanks very much. Thank you. I think it's over to Andy now from Glasgow.
Right, thank you very much, Carol, and to Kate for putting it on to the next slide. So yeah, it's been mentioned in a couple of presentations prior to now that the Right Decision Service will be talked about. So yep, that's my role. I'm going to talk about the Right Decision Service. I'll just introduce myself first. My name is Andy Willetts. I'm the Decision Support Programme Manager within Greater Glasgow and Clyde, Senior Manager within Library Services. So next slide, please, Kate. Okay, so what I'm firstly going to do is I'm going to set my timer for 5 minutes, because I know we're kind of running low on time, and so I don't talk for too long, so I've set that now. Right, so the Right Decision Service allows for decision support. So what is decision support? Well, from a staff perspective, it allows better decisions for patient care. And for patients, it allows them to manage their own care better. Okay, so next slide, please, Kate. Right, so the Right Decision Service. The way to access this is to go onto Google and to type Right Decisions in, and it's the first link that comes up. And it's been going just over a year, so it's quite new, really. It's known as a national mega app. So a mega app is an app which contains lots of other apps, and all the health boards within Scotland are on board with the Right Decision Service, which, like I say, provides decision support for staff and for patients. So you can search on this site by organisation. So you can find, for example, all the apps that have been produced by NHS GGC or NHS Lanarkshire. You can search by collection. So apps and similar topics can all be kept together. And I'll put a link to the site there, because I think the slides will be shared after the presentation. Next slide, please, Kate. Okay, so as I've mentioned, there are apps that are produced for staff who are going to help patients with their care, and apps produced for patients who are going to manage their own healthcare conditions. Next slide, please. Okay, so why has it been popular so far? Like I say, it's quite new, so we still need to promote, and we do have a communication and engagement plan that we're putting together. So it's popular because it provides evidence-based guidance, which is easy to access, which saves time for users, and in turn that improves patient safety, saves money. So it's a real focus area within NHS Scotland. Next slide, please. Right, so I thought I would just quickly explain what goes on to the Right Decision Service, because sometimes people come to me within GGC And anything they want developed digitally, they maybe think, right, I'm going to get an app created. But there's 3 criteria, and if anyone meets any of these, then it gets developed as a Right Decision Service app. So if there's clinical content, that is included as an RDS app. If there's any form of interactivity, this is crucial. So for staff, there might be a question and answer pathway where staff click through several answers and then get a recommended course of action based on the calculator within the Right Decision Service. Or from a patient point of view, it can be used as a symptom tracker, so they could answer lots of questions about their symptoms and be given a suggested course of action. The other reason something is taken on as a Right Decision Service development is if the user requires access to mobile device. So say, for example, it's a member of staff who's not at their desk, if they're on the ward or in the community, and has to access via app, then it's taken on as a Right Decision Service for that reason. Next slide, please, Kate. Right, if it's just basic information, like from a GGC point of view, we'd suggest to staff just put it on the intranet. And if it's just information for patients, it could go on the GGC website. So I think a crucial point here, if something is going to be developed into a Right Decision Service app, there has to be some sort of interactivity, something that requires decision support. So from a pathway point of view, asking questions and getting a suggested answer calculated by the calculators on the Right Decision Service website. Next slide, please, Kate. So RDS has a web version and an app version. Again, like I said, if you just Google Right Decisions, it's the first link that comes up. Next slide, please, Kate. So here's an example of an app homepage on the Right Decision Service web version. So the homepage has various chapters or tiles. So this one has 6 main chapters. If you click into any of them, the information is broken down into lists. So when people are developing apps, we say to them, look, organise in the first place how you want your content to be organised, main chapters, and then divided further. There's a link in here to a guided tour of the website. Next slide, please, Kate. If you want the app, though, it's exactly the same content, but you can access it via app. So if you're not typing Right Decisions into Google, what you can do is go into the App Store, Google Play, wherever you get your apps from, type in Right Decisions. It doesn't come with any of the toolkits included. And then you have, because that would take up too much space, then you type in the name of the toolkit that you want. And as per the graphic of the phone on the right-hand side, the same information is included, but it's in a more mobile-friendly format. Next slide, please, Kate. So, very briefly, some features, some good features of the Right Decision Service. There is a shared content area where content can be put and then shared with any number of apps. And if it's updated in this shared location, it automatically updates everywhere else. So there's less need to duplicate work. Next slide, please. There's a question and answer pathway tool, which I've already mentioned. So staff can go on there and they can ask the patient a number of questions and then get a recommended course of action. Next slide, please. There's a pathway builder directly on the Right Decision Service where you can create pathways, and this is approved as best practice. Next slide, please. You can also embed YouTube videos and calendars and M365 and web report forms. So there's great things you can do with the Right Decision Service. This is the course of action that people are going towards if they want an app. So I think this is really going to take off. Next slide, please. Yep, so if anyone is interested, so if anyone here is from within GGC, the process is there's an SBAR form sent into the project management office. Please contact me for further information. If you're out with GGC, which I think most people in this call are, then please in the first instance, well, you're welcome to contact me, but Anne Wales is the National Director, so she would be able to guide you further. So if you know of any clinicians or any other staff who would be interested in developing a Right Decision Service, myself and Anne Wales are the people to contact. Next slide, I think that's maybe the last slide actually, Kate. Yes, that's me, so on to Igor. So thank you very much everyone for listening.
Thank you, Andy, thanks. That was really great. Hello, everyone. Thanks for having me. My name is Igor, and I'm one of the 5 information scientists providing library service at the Healthcare Improvement Scotland. Next slide, please, Kate. Briefly, something about our organization. We are the National Healthcare Improvement Organisation for Scotland. We're a public body, part of the Scottish NHS. We have a number of key functions, including inspecting and reviewing the quality of care provided by all NHS boards and other healthcare providers in Scotland. We support the development and implementation of improvement initiatives. We have a special team that support that. I'll say something about them briefly later. One of the other key functions is providing information and advice to the public about the quality of healthcare across the boards. We work with partners to improve the quality of health and social care in Scotland as well. Some of the key priorities of our organization are improving the safety and quality of care, obviously, reducing the health inequalities. That one is really, really important. And lately and into the future, supporting sustainable healthcare is going to be a big one. Next slide, please, Kate. So where does the library sit? We are part of the so-called Research and Information Service that sits within the Evidence and Digital Directorate. Our service, so RIS, we by identifying, appraising, and synthesizing evidence, we deliver and support innovation, research, and best practice in development, mobilization, and delivery of Healthcare Improvement Scotland evidence outputs. So we support all directorates with the evidence and support them to produce and manage their outputs. The library is a fully digital and distributed service, so there is no physical library as such. And we provide all core library services. We have, I like to call them our sister teams. It's not obvious, but the information management and governance is a separate team. Then there's the evidence and evaluation for improvement team. They support quality improvement across Healthcare Improvement Scotland and other national bodies. And there's also and is already explained in depth what this is about. There's the right decision service that we basically support with, I'll briefly say with what later. Next slide, please, Kate. So the library, essentially, we offer all of the core, the so-called classic library services so access to books. So if anyone needs a textbook, we would supply the textbook via the knowledge interaction. So the network of medical libraries in Scotland. We provide access to ebooks, so e-journals, databases, essentially any evidence that is needed for the work the institution does, we would supply that. One of our main functions is obviously literature searching, summarizing, synthesizing, critical appraisal, searching training as well. So information literacy and expert searching training is big, but obviously, we are the main team that supplies the evidence for the organization. So literature searching is really bread and butter. We support knowledge management, mobilization, and sharing. We do after-action reviews after big projects and support the so-called knowledge harvesting. So lessons learned and stuff. We support referencing, bibliography. So most of the products are public publications, and we support anything related with either during the process and at the end with referencing and bibliographies. We provide support and advice on copyright and intellectual property, and we also take care of the current awareness. So any of the departments interested in specialist areas, AI is big lately, we would work with them, set up the current awareness service and provide the current awareness bulletins. COVID work was big with Scottish government during the pandemic. That's one to mention. Next slide, please, Katie. So our partners within his, so that's the directorate, and this is just to show you, to give you an idea about all of the variety of subjects that could come up for searching or any other kind of information support. Scottish Guidelines Network is big with our teams because they constantly develop and update their guidelines. So expert searching, systematic searching is required, always required. Scottish Medicines Consortium, they appraise and approve new medicines and need the latest evidence when they review the pharmaceutical submissions. Scottish Health Technologies Group, they review all of the new medical technologies that companies wanted to, to start to be used within the NHS. So they review their submissions and then approve or don't their use within the NHS in Scotland. Lately, we've started working with external partners on accelerated national innovation adoptions. Then the Quality Assurance Directorate improvement is big, and standards and indicators as well. So all these, like I said, evidence supply and quality assurance, that's big. Can I have next slide, please, Kate? I won't spend too much time on this, and is already explained this in depth. The Right Decision Service is part of the Healthcare Improvement Scotland. The libraries or the information scientists team essentially supplies the evidence for production and updates of essentially any of the toolkits that aren't in the ownership of trusts or direct ownership of external bodies. We produce tools themselves. We can do that for external partners, and we assist or we carry out quality appraisal wherever it's needed of the apps and the content within the RDS tool, the RDS decision service. Can I have next slide, please, Kate? So something briefly about one other sister team. So the Evidence and Evaluation for Improvement team. They're a multidisciplinary team who aim to ensure the design and delivery of Healthcare Improvement Scotland improvement and redesign programs. So they essentially support all of the improvement programs within the NHS Scotland as such. Their main roles include researcher that support evidence reviews and anything related to that. So synthesis, evaluation, and everything else. They also have knowledge and information skills specialists. They can find, capture, and analyze information that support quality improvement and service design. And then there's also other team members, depending on the project that they're working on. They might have statistics specialists, or we are included for complex literature searches and health economists, for example, for economic evaluation. Next slide, please, Kate. So some of the main functions that they and support that they provide, essentially, as you can see, the whole of the life cycle of the evidence, depending on the improvement project, is supported. It starts with horizon scanning, back to all the way down to when the project is closed and basically goes live. They support at the very end demonstration to demonstrate the program impact. Next slide, please, Kate. I think that's essentially it as the whistle-stop tour of the library service at Healthcare Improvement Scotland. Any questions, you can email me or email our team. We're very happy to answer any questions. Thank you for having us. Thanks.
Wow, whistle-stop tours indeed. Thank you so much, Igor. I'm almost lost for words at just the sheer efficiency of our health librarians. Perfectly to time, perfect handovers, and I think you've actually even managed to answer the questions that were in the chat before we came to the Q&A. So, I mean, nothing could embody more the efficiency and the effectiveness and just the impact that you're all having day after day. If anybody does have any last minute questions, we can stay on for a few minutes more. Please just raise your hand or pop anything into the chat. But as I say, we're super duper impressed with the fact that you can answer them before we even come to them. And that was truly just such an exceptional showcase. I think the depth and breadth of what you're all doing in your various roles is totally underrated and underappreciated, and it's so wonderful to showcase it en masse today. And I think it does also epitomise just the unique role that library and information professionals have to play in society today. So thank you so much for sharing those insights. We really, really enjoyed it, and hopefully that's coming through in all the appreciation that's in the chat too. As I say, if anyone has, yes, capital letter thanks coming in. Really, really wonderful session. Thank you all. I'm going to pop a quick evaluation link in the chat. So if anybody can spare a minute or two, just short and sweet, we would really love to hear your thoughts on what you enjoyed most about the session. Hint, hint, if you put that you'd like to hear more from health librarians, we may just be able to make that happen. But yeah, above all, on behalf of the whole CILIPS team, thank you to Elizabeth for inaugurating, for orchestrating the whole session so perfectly, to Derek, to Kate, our own very own Chris Whitty for that fantastic slide sharing action today, as well as Fiona, Amanda and Carol, Andy and Igor. We're so appreciative to you all. And yes, hope to welcome you all back to a CILIPS online learning very, very soon. We'll pause the recording now, but if anybody does have any questions, we can hang on for a few minutes more. Thank you all.